Hello friends, my name is Dr. Farad Mumin and I'm MD physician practicing in Bhiwandi since last 18 years. Today I will give you some general information of diabetes. Now as we know, India is the diabetes capital of the entire world. That means largest number of diabetic patients are in India now. So taking care and treatment of diabetes becomes very important, and for that giving some information is very useful. So what is diabetes? Diabetes is nothing but relative deficiency of insulin in our body. Once the patient is diagnosed with diabetes, already 50% of his insulins are already lacking in his body. The role of insulin is to proper utilize of glucose in the body so that our body meets all the energy demands. Since there is always either quantity wise or relative lack of insulin, this glucose is not meet the energy demands of our body, and we land up in diabetes, and slowly we become weak and weaker day by day and land up in lot many complications. The risk factor for diabetes: any person who has got a family history of diabetes, any person who is more than 40 years old, who is not exercising well, who is overweight or is not taking proper food, all patient can land up in diabetes. Although there are two types of diabetes, that is type 1 diabetes, where there is absolute lack of insulin right from the birth, and this patient require insulin right from day 1. And what we are talking about is type 2 diabetes, which is also called as non-insulin dependent diabetes. That means it is metabolic in nature, and it happens in older patient like more than 40-year-old who is overweight, obese, lack of exercise. All these are the relative risk factor which can land you up in diabetes. So this is the cause for diabetes. What are the treatment for diabetes? The number one treatment of diabetes is your food control. What kind of food you should be taking throughout the day is very important. The caloric requirement of the body should be proper and balanced. Second is proper exercise, weight loss, making your BMI as per your weight, height and body. This is very important. And third and most important is consulting a doctor so that he can decide whether you require a medicine which can reduce your sugar, which are also called as diabetes reducing drugs or OHAs, and of course if the need require a combination of insulin so that this can be controlled, because for many years even after diagnosis the diabetes remain asymptomatic. That means you do not recognize externally, and internally it adversely affects and damages your kidneys, heart, brain and even your all the nerves of the body. So by the time you land up in any of this complication, reducing sugar is very important. And the last line, once the patient, when we call a patient as diabetic, when his fasting sugar in the morning is more than 126 and his postprandial, that is 2 hours after the food, is more than 140, or if the glycated hemoglobin is more than 6.5 or 7, that means you are already diabetic and definitely you require treatment. So lifestyle modification, food and drugs, these are the three important factors whereby you can control a diabetes and remain healthy for the rest of your life. Thank you very much.